Thank you so much for joining me, Dr. Marco. I'm so grateful to have you as a wellness colleague and that you've agreed to having this chat with me today. So for those of you that are joining us, this is Dr. Marco Caravaggio. He's a pediatric and family chiropractor. And the conversation today will be dealing with respect to stress, especially the tense stress that we may be feeling today, the fact that we're sitting longer hours perhaps at our desk. And in conversation with a number of people and also with myself, I'm feeling a bit more tension with my shoulders, a little bit more with my back. And obviously it's due to stress, but also a lot of sitting. So I'm inviting Dr. Marco to give us some tips, maybe some tricks on how we can deal with this stress in our bodies and in our daily life.
Sure.
Can you tell us a little bit about your background and a little bit about some stress tips?
Okay, so background, I'm Canadian born, and I went to the Canadian Memorial Chiropractic College and I graduated there in 1994. And then I actually went on a big trip and I went over to Italy and practiced in Italy for about 20 years. And then met the love of my life and had to come back to Canada. So I've been back in Canada for over 10 years now, something like that. And so I do chiropractic care, and I've had an interest in nutrition and wellness and neurology since I've been a chiropractor, basically, even nutrition even before that, but all the way through. And so a lot of the tips I might be giving, hopefully there'll be something different than the typical things, because I might add in a bit about how the brain can influence the body and how we can do things specifically neurologically to release some of these stress situations that we're in right now.
Mm-hmm. So what are some tips that you can give us if we're sitting longer, we're feeling stressed just because of the environment that we're in, the climate that we're in? What are some suggestions you can provide to us?
So there's a few things. So obviously if people, a lot of people are stuck at their jobs and they are sitting, and sometimes people say you have to get up and you got to move around, and people kind of know that, but they actually think they actually have to get up and like walk and stuff. But they actually just found that if you actually just stand up, even just like 5 seconds and get back down again, just that change can be helpful. Because some people think I have to go walk and exercise and move around. Like I don't have time to get up, I'm so busy. But even I've just read that even just standing, just get up and stand and then just sit back down again, even just that change can be helpful. There's a concept that the problem with the sitting is that we have ligaments and holding elements around all our bones and our spine. And when something is held in one position for a long, long time, it starts to stretch. There's this thing called creep and hysteresis, which are these big words. It just means ligaments are things that don't normally stretch. They start to lose their kind of elasticity. So I tell people it's kind of like, the elastic band in your underwear. It snaps back when it's fresh, but when it's really old, it doesn't snap back anymore. So when your ligaments get loose like that, they don't hold things as well. So when people are sitting for a long time and they get up and move around, they're often prone to having these instability injuries where they're just moving to pick something up and then all of a sudden it blows up because the ligaments haven't been holding because they've been stretched out a little bit. So it is important to change that position as often as you can. So a couple of things about just having stress in general. A lot of times all our life is just getting into the neurology. We're kind of going down into flexion, we call it, like bending like this. So we all start off as a baby curved like this. And then as your brain develops, it starts to, we call inhibit the flexing muscles. So that way you can start to extend your body and become upright. So that's when the brain gets healthier, we become upright. And part of that is the eyes diverging. So a lot of our work is making our eyes converge. So as looking at our screen, everything is really close to us here. And that convergence has a tendency to decrease that inhibition or the blocking of the flexing muscles. So they start to become more dominant. And then we're all tense back here because we've become flexed in our society again. So we need to do some things that can reestablish extension. So even if you can't necessarily get up and move around, just changing your eye position can be helpful. So if you're lucky enough to be sitting at a job or at a desk that has like a window, you can do a little exercise where you can put your thumb in front of you at arm's distance. So you look at your thumb here, but then you choose an object that's like as far away as you can look, really in the distance. And then you look at that object. So your eyes will be close here, and then to look at that far object. And just the fact that they diverge helps your body and your neurology get into the extension mode again. Because when we're looking and hunting, we're up like this, and that's upright. We're looking in the distance for prey, that kind of thing. So when our eyes diverge, it helps to get that extension into our body. So if you're at a desk for a long, long time, get up, find an object that's in the distance, look at your thumb first, look at the object, and just go back and forth like that. So you're exercising the divergence of your eyes. That's one thing that'll help some of the neurology. A couple of other things, when people are the curve in your neck is really important. I'm going to show you a little model here. So this is a small model of our spine. Okay, this is like a baby spine that I work on because I work with babies too. But this is the person is looking this way. So normally there's a little curve in your lower back. It goes backwards, and then there should be a nice curve in your neck. Mm-hmm. So everyone should have a nice curve in our neck, and our society is making that curve in our neck disappear because we're all looking forward, looking down at devices. So the thing that actually created that curve in your neck is sideways movement of your head. So when you think about babies, we usually put them down on their stomach and their heads are turned, and they have to activate these things to get their head up to look around. So remodeling that motion can help reestablish that curve in your neck. So there's these little canals in your ears. People might have heard that people get dizzy suddenly. They're called the vestibular canals, or the canals in your ears, and they have these fluid in them that kind of tells your brain where you are, and they kind of turn like this. So if we can stimulate those vestibular canals, that helps to stimulate the muscles that create the curve in our neck again. So there's a really unique neurological exercise you can do. So you're going to have your thumb in front of you like this, and your nose is going to be connected to your thumb, so they move together. So the idea is, the exercise is, you're going to take your thumb and you're going to find the back corners of your room, and you're going to trace your head and follow your finger back like that. So you're going back towards the corners like this. So I'm not just turning my head sideways, I'm actually going up in an angle like that. So the head is kind of going this way and that way. So you can do like 10 or 15 repetitions one way like this, and you can mix it up. So you really want your head to go back and around. So that's going to stimulate those canals, which helps stimulate the muscles that create that curve in your neck again, which is really important. One other thing, as far as tension in your muscles. So there's a thing, if I take my arm here, if I contract this muscle, my brain has to relax the muscle on the opposite side. Because if they both contract, then I can't move. So there's a thing called reciprocal inhibition, meaning I flex this one, the brain says I gotta let that one go so my arm can move. So a lot of people, when they're sitting at their desk, they always have a lot of tension in the back. Everyone's complaining, my neck's killing me. And a lot of times people are told to stretch and stretch out like this, which can be okay, but typically a tight muscle is also a weak muscle, and stretching a weak muscle isn't always a great idea sometimes. So what happens is, if you want to get that neurological aspect to it, this is a little trick you can do. Because these muscles might feel tight, you actually want to contract the muscles on the opposite side so your brain lets go of that tension. So the trick is, you're actually going to push against your hands like this and create resistance here, and you're going to push this way. So you're activating these muscles, and the brain has to let go of the tension in the back muscles. And that's a really unique trick neurologically to get your brain to let go of that tension in the shoulders. So that's just a couple of things I thought of. Any questions about that so far?
Amazing, amazing. These are great tips for me too, because I usually have some tension in along my my neck.
Yes.
And I have actually through something that you sent a little while ago to your wellness patients, you had shown some stretches with respect to applying a little bit of pressure and then pushing against. So I understand this, and it really does help.
Yeah, it's a really unique thing. And might get into it later, but I have like a YouTube channel, and I've got like over 300 videos, health tips and things like that. And the most popular one is how to stop a calf cramp. Typically when people's calves are cramping, they usually try to stretch out the calf. But the trick is, you actually have to contract the muscle on the other side of the calf, right? So luckily I got my shorts on. So I'll just show you. So even this is everything. Here's your calf muscle. So typically people say I got to stretch it out, but actually you have to activate these muscles here. So you put resistance this way. I'm going to try to flex this up, and I'm going to resist that way. So that's activating the muscle on this side, and my brain has to let go of the calf contraction on the other side. So you can put one foot here and you push up that way. So I'm pushing up like this against resistance. That activates this muscle and helps to relax the calf muscle on the other side. So that's just a side note, but that's the same concept of that thing I just described with the neck. You contract the front ones, the brain has to let go of the ones in the back.
That one I need to try, because I've got tight calf muscles because of the Zumba that I teach. So Thank you. That's a great tip. Can you chat briefly about sympathetic versus parasympathetic?
Certainly. Yeah, so that's really important. So when we talk about our nerve system, there's kind of two global categories. There's something called the voluntary nerve system, like I voluntarily want to move my arm. I'm doing that on purpose. I can do that. I can control that. The other system is called the autonomic one, which means automatic. And that's the one that's beating my heart right now, making you breathe, digesting your food, controlling your blood pressure. So that system inside our body has to have adaptability for us to adapt to the environment. So it kind of has two sides to the system. One side would speed things up, like if I had to beat somebody up or run for the bus, so that would increase my heart rate, increase my breathing. The other side needs to slow those things down. So the speeding up side, the technical word is the sympathetic nervous system, also known as fight or flight. The other side is called the parasympathetic nervous system, which we call the rest and digest side. So people think, well, it's better to be on the rest and digest side all the time. Actually, it's not. We just need to be in both, because we need some stress to challenge your body, but we also need to be able to recover. The problem is when people get stuck on one side or the other. So there's a technology I use in my office. There's a little handheld machine that measures your heart beating for about 3 minutes. It's called heart rate variability. And that's one of the more important tests, health measure tests, because it really gives us a lot of good indication of how balanced that system is. And that system is super important for people with outcomes like, cardiovascular things, but also cancers and things like that. When people had poor heart rate variability tests, they were more prone to have problems like, bad cancer outcomes, bad cardiovascular, diabetes, all sorts of things, because that system is not balanced. And it's not good that your body can be stuck on one side. And typically our society is pushing us to the sympathetic side all the time. Some of the ramifications of the sympathetic side are just that your body is just thinking about survival, and it's not thinking about thriving or repairing anymore. So then you'll have less blood flow to your intestines, less blood flow to your brain. The muscles might be more active and you might get jittery and that kind of thing, but you're not digesting your food properly, and all sorts of things can happen. So a couple of things to help get us out of that situation is just changing your breathing pattern. So a lot of times when people are stressed, they usually do chest breathing. They're kind of, all uptight and breathing up here. And as soon as if you switch it down and go down to your diaphragm, which is down lower here, so you do your belly breathing. Okay, so belly breathing is a really good way of kind of going back to where we were when we were a little baby. You put a baby on their back and you see that belly going up and down. So just kind of stimulating that sort of belly breathing. So I always tell people, put one hand on your chest, one hand on your belly. And if you're doing good belly breathing, only the bottom hand should move, the top one shouldn't, because most people kind of breathe like this, but it actually should be more like this. So you can get into a lot of different breathing timing and patterns and things like, breathing in, breathing out for 2 or 3 or 4 times longer than you're breathing in. So just controlling that exhalation. There's something called square breathing, where you breathe in for 4 seconds, hold it for 4 seconds, breathe out for 4 seconds, pause again, and then breathe in again. So just very deliberate, controlled breathing. Some other things, there's a big nerve that comes out of your brain called the vagus nerve. Vagus is vagabondo in Italian, means the wanderer. So it's the kind of nerve that will go down and control all the different organs, your heart, your lungs, your kidneys, your intestines, and all different sorts of things. Some things that will stimulate your vagus nerve are cold exposure, like having cold water splashing on your face or on your chest. Gargling really vigorously can help the vagus nerve. The breathing patterns, massage, yoga, these are some other things you can do. And we've also found that getting chiropractic care is very helpful for stimulating the brain and stimulating the vagus nerve as well, especially the type of chiropractic care, the light touch one that I do called network spinal care that you mentioned. Mm-hmm. Very light touches can help stimulate the brain and get the body to let go of that stress response and kind of pay attention to itself and say, okay, I can relax and we can start to heal again. Mm-hmm. So those are some of the things there you can do for that.
And I know for myself, I didn't realize that I was unconsciously in the sympathetic mode all the time.
Yes.
Until I got tested. Mm-hmm. and then realized, wow, I had been living, I don't know how many years in the sympathetic fight or flight.
Correct.
And it was a period of time of care and also breathing and a lot of different techniques that helped. And I know I have a bit more to go.
Yes, for sure. We all do.
So, thank you so much for joining me. Now, if someone who's listening to this recording wishes to reach out to you, how would they get in contact with you? What, phone number, email, spelling of your name, clinic?
Okay, so my name is Marco Caravaggio. So the last name is C-A-R-A, V as in Victor, A-G-G-I-O, Caravaggio, like the Italian artist. The clinic is called Network Family Care Center. So right now with the quarantine, we're kind of closed, but we're only seeing emergency patients. But the center is spelled BR, the American way, Network Family Care Center. To find my stuff, I made like a hub site that has a lot of connections to the different websites I have. If you spell out the word doctor, Marco, and then DC, like Doctor of Chiropractic, drmarcodc.com. On that site there, you can have a link to my YouTube channel, you can have a link to my website, to my blog, and all the different things. So that's a way to connect. And then on my office website, you can find the email and the phone number, which is 905-477-8900. That's the number for the office.
And you're located at 404 in Steeles in Markham.
404 in Steeles and Markham, really convenient to all the highway and all the different routes and connections. It's a very convenient place.
Thank you so much for your time. I really appreciate this opportunity to learn these different stress techniques. Very, very powerful. Thank you.
It was a pleasure having you. Thanks. Bye-bye.
Bye.